Must be nice to start off the morning like that, Uncle Tabsy and Jamie. Hey, please save some for me too for a little later on. But right now, though, it's time for that COVID-19 update. As COVID-19 continues to spread rapidly worldwide, the race is on for a vaccine to curb the spread of the deadly infection. Currently, there is still no medication that can kill the virus, but scientists and researchers are working around the clock to develop a vaccine that can protect us against the coronavirus. Here to give us the latest update on the COVID-19, please welcome medical doctor and public health medicine specialist, Dr. Kerrin Begg, who joins us via video call. First of all, good morning and thank you so much for joining us this morning.
Good morning. Thank you very much.
Doctor, the first question is quite packed. I mean, we want to know so much in so little time. What is the latest statistics on the coronavirus in South Africa? How many people are infected and how many people have died? Are there also any new recoveries so far? And just a general update on the worldwide statistics.
Sure. So as of last night, the statistics in South Africa were 1,686 cases. And we had tested over 58,000. Our deaths increased by 1 yesterday, so we now have 12 deaths related to COVID-19, and we have 45 confirmed recoveries.
Oh, wow.
So that appears to be very small, but remember that our epidemic currently in South Africa is only a month old. Our first case was detected on the 5th of March, was diagnosed on the 5th of March, and we're only on the 7th of April now. So this is still very early days in our epidemic.
So in your opinion, doctor, do you think that the spread is much more given the time period since the first person was diagnosed?
Well, I think that we're cautiously optimistic right now that we had expected to have had more cases at this stage of the epidemic. We'd expected to be close to 4,000 to 5,000 based on other trends in the world. So it was a credit to our president and the South African government to have instituted measures so quickly. Firstly, the state of disaster declaration, and secondly, the lockdown. So that may well have helped us. Of course, are we testing enough? Are we detecting enough? Is the one question. And the second question is whether we are only seeing the first part of the wave of our epidemic, which is the imported cases, which were those that were from travellers who travelled either back from Europe or were visitors who came from Europe. So that's the one aspect, and then that we're only starting to really see community transmission now, and we may see a significant rise in cases going forward.
Doctor, we've spoken a lot of social distancing and keeping a safe distance of 1 or 2 meters. A researcher at Massachusetts Institute of Technology has said this isn't enough to stop the spread of COVID-19. What is your input on this?
So COVID-19, or the SARS-CoV-2 virus, is spread in droplets. So that means anything from our respiratory secretions. So from our nose if we sneeze, or from our mouths if we cough, or of course if we touch our hands to our mouths and noses and then touch other surfaces or touch other people. So that's where the general sneeze or large droplets are usually the distance that they land is somewhere between is usually under a meter, between 1 and 1.5 meters. And that's why the social distancing or the physical distancing has been set at around 1.5 meters. The concern, as has been raised by some scientists, is that there are micro droplets. So in other words, those large droplets can aerosolize and can be spread a lot further, especially when there is a propellant, such as a very large sneeze. So that's the challenge. The bottom line is to stay away from people. This is not the time to be hugging, touching, and being close to people in general. So that's why the lockdown, staying at home, is so important, because then you don't have to measure the distance between 1.5 meters or more with people.
That's why we're also promoting hashtag Stay Home right here on the show. But doctor, what is the BCG
Absolutely, the
vaccine?
most important thing.
Pardon?
The most important thing, to stay home.
Absolutely. What is the BCG vaccine that is used to treat TB patients, and how can it help fight the coronavirus? Can it fight the coronavirus?
Okay, so firstly, it can't fight the coronavirus. The Bacillus calmette-guerin vaccine, or BCG vaccine, was developed to fight TB, tuberculosis. And we've used it extensively, as have many other countries in the world, as part of our extended program of immunization. That means that children, all children, it's a universal vaccine in South Africa, so all children born get the BCG at birth. It's protective against the disseminated forms of TB. So it's not protective against the mild form of TB so much in terms of pulmonary TB, but it is protective against the severe forms of TB, such as spinal TB and disseminated TB. So the reason why BCG has come under interest at the moment is that an ecological study, that means a study looking at populations, has observed, so this is not an experimental study, so we're always a little bit cautious about making conclusions around an observational study. And what they found is an association between populations or countries with populations who have had universal BCG vaccination for a long time, many decades, versus those countries who no longer use BCG vaccination at birth because they no longer have very many TB cases. So those are countries like Italy and United States no longer use BCG, whereas those countries who still use BCG appear to have a lesser severe form of Covid-19. And so that observation was picked up. So what that means is that there's an association or a correlation between that. Whether that is causative or protective, we can't say at this stage. In any event, the challenge is that if it were to be protective, it would be protective because you've had it a number of years ago. So to use it right now is unlikely to be protective. So it's a wait and see as to whether, as more evidence emerges, as to whether the BCG may well be protective for populations that have had it for many decades.
Dr. Kerrin, thank you so much for joining us this morning. We could have this conversation the entire morning. I think it's important that we shed some light on the current pandemic that we are facing as a globe, so as to kind of step away from the darkness, because it is anxious times, and I'm pretty sure everyone is just filled with doubts and uncertainty. So once again, thank you so much for shedding some light.
An absolute
enjoy
pleasure.
the rest of your morning.
Thank you. Thank you very much. Thanks for having me.
That was Dr. Kerrin Begg shedding some light on the current COVID-19 and its updates. Right now, we're going to take a quick break. Please keep it locked right here on your Feel Good Breakfast show. We'll see you after this.